Masturbation is a normal, common sexual behavior across age groups and cultures. For men, it's often the easiest way to experience sexual pleasure, learn about personal preferences, and relieve sexual tension. Beyond pleasure, a growing body of research and clinical commentary describes several potential physical and mental health benefits associated with regular masturbation and ejaculation. This video reviews the physiological mechanisms at play, summarizes the evidence for key health effects, highlights limits and risks, and offers practical, harm-minimizing guidance for men considering daily masturbation as part of a healthy lifestyle. This is an informational, evidence-informed overview, not medical advice. If you have specific medical concerns, e.g. sexual dysfunction, compulsive sexual behavior, pain, fertility questions, consult a licensed clinician. Masturbation can improve sexual self-knowledge, which often translates into better partnered sex and sexual function. Potential downsides include the possibility of compulsive behavior, physical irritation if done aggressively, and emotional distress, where cultural or religious beliefs make masturbation psychologically burdensome. Practiced reasonably and hygienically, daily masturbation is generally safe for most men. If it interferes with daily life or relationships, professional help is maybe needed. How masturbation affects the body. Sexual arousal and orgasm produce a predictable cascade of neurochemical and endocrine effects. Dopamine rises during arousal and contributes to motivated behavior and pleasure. Oxytocin, often called the bonding or love hormone, it increases around orgasm and is associated with relaxation and decreased stress responses. Endorphins and endocannabinoids, endogenous pain-relieving and mood-elevating compounds released during sexual activity and orgasm. Prolactin, typically spikes after orgasm. Prolactin resulting in sexual satisfaction and the refractory period, the temporary reduction in sexual arousal after orgasm. Cortisol. Oxytocin and other mechanisms can counteract cortisol, the stress hormone, producing a calming effect in many people. These hormonal shifts explain why many people report immediate reductions in stress, improved mood, short-term increases in well-being, and sometimes improved sleep after masturbating. Sources and studies. Mental health and stress reduction. One of the most commonly reported benefits of masturbation is stress relief. The combination of dopamine, oxytocin, endorphins, and transient reduction in cortisol explains the calming, mood-elevating sensation many men feel after orgasm. Stress and anxiety. Oxytocin and endorphins can reduce perceived stress and overall tension. Many people use masturbation intentionally as a coping mechanism for acute stress. Mood. Dopaminergic reinforcement and endorphin release contribute to transient improvements in mood and a feeling of well-being. Depression and depressive symptoms. Masturbation is not a substitute for professional treatment for clinical depression, but it may temporarily improve mood for some individuals. Phenylethylamine and endorphins are released during sex, and more so during orgasm. These hormones can lessen the effects of stress and ward off depression. Phenylethylamine can give one a good overall feeling, while low serotonin levels are linked to depression. This information stems from laboratory hormone measurements, cross-sectional surveys, and self-report data. These indicate consistent short-term benefits for mood and stress in many people, though results may vary from person to person. Sleep and relaxation. Need to get a good night's sleep? Often when sex ends in orgasm, one can't help but fall asleep. Following orgasm, the body releases oxytocin and prolactin that result in feelings of satisfaction and happiness. At the same time, production of cortisol, a hormone that induces alertness and stress, decreases. This combination of hormonal processes makes people feel extremely relaxed and drowsy. Sleep improvement. Several surveys and self-report studies show that people perceive masturbation as sleep-promoting. Natural and effective pain relief studies have shown that chemicals released in the brain during sex can have an effect on pain. Endorphins and beta-endorphins have been referred to as nature's opioid because of their ability to block pain and make one feel good. Having sex may be a fun way to relieve some aches and pains. Of course, this may not be the answer to chronic or severe pain, but it can relieve some levels of discomfort. While masturbation may provide short-term relief for some types of pain, e.g., component placement, tension headaches for some people, it is not a treatment for chronic pain. Could lower the risk of prostate cancer. The prostate is a small gland that produces semen. Ejaculation activates the prostate to produce more semen. A study, which was published in the Journal of the American Medical Association, concluded that men who ejaculated frequently, at least 21 times a month, were less likely to get prostate cancer. Sexual function, performance, and self-knowledge. Regular masturbation helps many men learn what kinds of stimulation lead to arousal and orgasm, which usually improves partnered sexual function and communication. Specific benefits include better control. Learning timing, stimulation types, and techniques can help men manage premature ejaculation or tailor stimulation to last longer with partners. Erections and pelvic floor muscles. Masturbation is an opportunity to exercise erections and the pelvic floor, which may help maintain function with age. Erectile dysfunction, ED. Masturbation itself doesn't reliably treat organic ED, but it can be part of behavioral strategies and sexual rehabilitation after prostate or pelvic procedures when used with guidance. Many sex therapists recommend masturbation as part of sexual rehabilitation and skill building, cognitive effects, and post-orgasm clarity. Some small studies and observational data link sexual activity with short-term cognitive changes, improved attention or short-term memory in specific tasks. Post-orgasm clarity is commonly reported, immune function and other systemic effects. Researchers discovered that subjects who engaged in ejaculation a few times a week had higher levels of immunoglobulin A, an antibody that helps fight infections. In fact, people who have sex 1 to 2 times a week have 3 times as much immunoglobulin as those who don't. As sexual activity increases, the boost to the immune system is better able to protect the body from infection. Improved circulation. Sexual activity, especially activity that ends in orgasm, increases oxygen-rich blood flow. The increased blood flow is helping to eliminate toxins and aids the healthy function of all your body's systems, lowers blood pressure. Research has found that frequent ejaculation can lower systolic blood pressure. Orgasms cause arteries in the body to relax, lowering your blood pressure, risks, harms, and when to seek help. Masturbation is safe for most men, but there are possible downsides if it becomes excessive or practiced harmfully. Compulsive sexual behavior. If masturbation interferes with work, relationships, sleep, or mental health, it may be part of a compulsive sexual behavior pattern. Physical injury. Aggressive or prolonged mechanical stimulation can cause skin irritation, frenular tears, Peyronie-type trauma, or transient soreness. Use lubrication and safe technique to minimize injury. Psychological distress. Guilt, shame, or moral conflict about masturbation can cause distress. Speaking with a counselor or sex therapist can help reframe beliefs and reduce anxiety. Post-orgasmic illness syndrome, POS. A rare disorder where some men experience flu-like symptoms after orgasm. If you suspect POIS, see a specialist. Sexual dysfunction. If you experience pain, persistent changes in ejaculation, or erectile problems, a medical evaluation is appropriate. Resources: clinical overviews and reviews. Cleveland Clinic Healthline highlight screening and referral for problematic behaviors. If you choose to masturbate frequently, here are practical tips to keep it safe, hygienic, and beneficial. Technique and hygiene. Use adequate lubrication to avoid friction sores. Keep hands and any devices clean. Clean sex toys, according to manufacturer instructions. Avoid forceful or high-velocity repetitive motion that could cause tissue trauma. Monitor whether masturbation is displacing work, relationships, exercise, or sleep. If so, consider reducing frequency and exploring triggers: boredom, anxiety, loneliness. Use masturbation to improve sexual self-knowledge. Practice techniques that improve endurance and awareness of arousal, so partnered sex benefits, sleep, and stress. If you use masturbation to aid sleep, observe whether perceived improvements match objective sleep quality. If sleep problems persist, seek a sleep evaluation. For most men, daily masturbation is a normal, typically harmless activity that can yield real short-term benefits. Stress relief, mood lift, improved relaxation, and possibly better sleep and sexual self-knowledge. There is evidence that frequent ejaculation is associated with lower prostate cancer risk. Masturbation, however, is not a substitute for medical treatment, and none of this is intended as medical advice. Please consult a medical professional to see if increased sexual activity is okay for you. If masturbation feels compulsive, physically harmful, or emotionally distressing, or if you have questions about fertility, erectile function, or unusual post-orgasm symptoms, consult a healthcare professional, primary care doctor, urologist, or a certified sex therapist. Please leave your thoughts about this video in the comment section. Give us a like and subscribe to this channel. It would be greatly appreciated. Thank you.